Lecture number 3, we're going to talk more about the function of the structure and the function of the penis. And again, some of this information has already been covered over on the anatomy side. All right, so male external genitalia. The reproductive organs that are visible include the scrotum, where the testes are located on the inside, and the epididymis is located on the inside, and you have that first part of the vas deferens, and the penis. The penis is obviously the male copulatory organ that is used for copulation or sex. The penis consists of the shaft and also the root that anchors it inside the abdominopelvic cavity. And it ends in a structure called the glans, or the glans penis, often called the head of the penis. The clinical or anatomical term for that is the glans. Also, men are born with a prepuce or foreskin, which is a loose skin covering around the glans. And of course, it's many males in the United States are circumcised at birth. So circumcision involves the removal of the foreskin, which is often performed, still often performed when male babies are born. Then also there are some structures called the crura, which we'll be taking a look at over on the anatomy side. And those are the proximal ends of the corpora cavernosa, which are tissue structures that are located up on the top portion of the penis, and those extend into the abdominopelvic cavity, and they help anchor the penis to the pubic arch, if you remember that from the skeletal system. So all of those things are connected together there. And here's circumcision. This is still performed on about 60% of newborn boys in the United States. It's a quick surgical removal of the foreskin. It's a little more complicated if you get circumcised when you're older. Still performed on about 60% of males, but only about 15% in other parts of the world. Just depends on the culture and the customs. Many people feel that it's medically unnecessary. However, there have been some studies that have shown that there's a 60% reduction in HIV risk among circumcised males versus non-circumcised, and it's also has been shown to reduce the risk for other reproductive system infections as well. All right, if you look at the internal tissues of the penis, and again, this is covered over on the anatomy side as well. First of all, the urethra is passing through the inside of the penis, as we talked about when we covered the reproductive system, the urinary system, I'm sorry. The pen doesn't want to come back up here. But the bulk of the inside of the penis consists of 3 cylinders, or cylindrical bodies, of erectile tissue. So these are spongy tissues that have little compartments on the inside of them. They're connective tissues, and the spaces in there are what fill with blood during erection. All right, and so there's one corpus spongiosum, and that is the erectile tissue that the urethra is actually passing through, the spongy urethra. And it's called that because it's passing through the corpus spongiosum. It doesn't mean the urethra itself is spongy. And the corpus spongiosum, so this is actually on the bottom part of the penis, it actually expands to form the glans, or the head of the penis, at the distal end of the penis. At the proximal end, and proximal here is referring to closeness to the abdominopelvic cavity, the trunk, it expands to form the bulb, which along with the crura help anchor the penis to the abdominopelvic cavity. Okay, and then on the top part of the penis, you have corpora cavernosa. Those are 2 cylinders of spongy erectile tissues that are located up on the top part of the penis. Or that's also called the dorsal aspect of the penis. And probably the easiest way to remember dorsal versus ventral when you're thinking about a penis is think about the penis in an erect state. The dorsal side is going to be the posterior side and facing the body. The ventral side is the anterior portion when the penis is in an erect state. During erection, these erectile tissues fill with blood, so there are arteries that dilate and allow blood to flow out of them and fill up these spaces within the spongy tissue, and that allows the penis to enlarge and become rigid, which is necessary for sexual intercourse. Okay, we will have taken a look at this. This is a diagram from your textbook, which is pretty good. It's not really giving you much of a 3D perspective, but it does kind of give you some feel for how these different structures are laid out relative to each other. But all right, here's a testis. Just to review, testis, epididymis, sperm flows out of the epididymis through the vas deferens up into the abdominopelvic cavity, and the vas deferens wraps around the top of the bladder to the back side, and then it widens and forms an area called the ampulla of the vas deferens. And then here's a seminal gland over here, or a seminal vesicle. And fluids from the seminal vesicle combine with the sperm that are located in the vas deferens, and they combine together in a little short area right there called the ejaculatory duct. During ejaculation, that semen fluid that contains the sperm and the fluids of the seminal vesicles, they enter this first stretch of the urethra called the prostatic urethra, and the prostate also secretes fluids that combine with the others to help form the semen. And then the urethra leaves the prostate gland, and there's a little short passageway right here through the muscular floor of the pelvis, and then it enters into the penis right in here, and it's passing through the corpus spongiosum, and that's where it's called the spongy urethra. So on the diagram, all the little blue speckled tissues there represent the erectile tissues of the penis. And here's a penis shown in cross section, and you have the two right there and right there, corpora cavernosa, that are up on the top part of the dorsal side of the penis, and one corpus spongiosum located on the lower, or the ventral portion of the penis, and that's where your urethra is located. That's what it's passing through. And then the gray tissues that you see in there, those are connective tissue coverings that you have around these erectile tissues, and those also contain blood vessels and nerves and lymphatic vessels, all the usual good things that you have passing through your connective tissues. All right, the next lecture we're going to talk more about these male reproductive ducts and glands, although I just reviewed some of that at the end of lecture number 3, and we'll talk a little bit more about their functions.